Hi, so let's continue. Neurofibromatosis or von Recklinghausen disease of skin. Neurofibromatosis associated with multiple neurofibromas. Associated with multiple neurofibromas. Neurofibromatosis, von Recklinghausen disease of skin associated with multiple neurofibromas. Um, Autosomal dominant type 1 or type 2 or schwannomatosis, which is rare. Okay. Neurofibromatosis, also called as von Recklinghausen disease of skin, associated with multiple neurofibromas. Multiple. Okay, neurofibromas are of two types. We have seen in the previous video. Isolated, solitary, or multiple. So, with multiple neurofibromas, it is associated. Okay, these are of neurofibromas are of three types: type 1, type 2, and one rare type which is called as schwannomatosis. Neurofibroma type 1 NF1 gene is involved, type 2 NF2 gene is involved. Neurofibromin gene, it is called as type 1 gene is called as neurofibromin gene, and type 2 gene is called as schwa schwannomin gene. Okay, here chromosome 17 is involved, 1 1 1 7 2 2 2 2. Chromosome 22 is involved, 17 and 22. Fused neurofibroma seen in plexiform variant of neurofibromatosis. Hanging mass, soft tissue. Hanging soft tissue mass is present seen in fused neurofibromas. Fused neurofibroma seen in plexiform variant of neurofibromatosis. Hanging soft tissue mass compared with bag of worms, like like bag of worms, hanging type, elephant like, also called as elephant man syndrome. Okay, von Recklinghausen disease. Skin. Yeah. Okay, von Recklinghausen disease of skin is neurofibromatosis, and von Recklinghausen disease of bone is hyperparathyroidism or Brown's tumor, increased PTH. Then clinical features: cafe or pigmentation, macule, smooth margins. Here in neurofibromatosis, cafe alert spots has smooth margins, coast like coast of California. Differential diagnosis: coast of mean irregular margins. Polyostotic or McEwen-Albright syndrome. Their cafe all out spots has irregular margins or coast of mean. California has smooth margins. Okay. Then freckles in auxiliary area in neurofibromatosis, which is called as crow sign. Then Lish nodule is present here, seen in iris. Lish nodule. Okay. Melanotic hematomas increase melanin. Okay, melanotic hematomas are seen in the eye. Okay, Lish nodules increase melanin is present. Optic ganglion tumor associated with glial cells. Optic glioma tumor associated with glial tumor associated with optic nerve. Okay, then neurolymoma or schwannoma, Schwann cells proliferating help help to formation of a myelin sheath. Histologic: head and neck region, intraorally, most common site tongue. Most common site for almost all neural tumors is tongue, but then buccal mucosa, labial mucosa, floor of the mouth, and soft palate. Schwann cells are proliferating here, help to formation of myelin sheath. Okay, most commonly neurolymoma or schwannoma is present in tongue. Okay, then histopathology: two types of cellular arrangement, Antony type A and Antony type B. Okay, in Antony type A, palisaded appearance, tumor cells, nuclei at adjacent cells at same level. Nuclei are at same level. The empty space between the cells is in a clear acellular homogeneous eosinophilic glass-like island-like called as Verroque bodies. In Antony type B, it's like pipe and it's like enclosed there. Antony type A. Schwann cells are randomly arranged and the nuclei are also randomly arranged. Then in between them, Verroque body is present. Treatment: surgical excision, good prognosis is there. Then melanotic neuroectodermal tumor of infancy, melanotic neuro, also called as pigmented ameloblastoma, melanoameloblastoma, old terms, also called as pigmented ameloblastoma or melanoameloblastoma, most common in maxilla. Also called as also known as pigmented ameloblastoma or melanoameloblastoma. Blastoma most common in maxilla. Odontogenic tumor believed to be odontogenic tumor. It is believed to be pigmented ameloblastoma are the old terms. Not now we don't call it as ameloblastoma because it's not seen in tooth bearing area. Melanotic neuroectodermal tumor of infancy, commonly seen in maxilla, believed to be odontogenic tumor seen in tooth bearing area. Histopathology, lots of melanin deposition is present there. These cells neuroectodermal in origin, seen in newborn 0 to 6 months. Okay, then spindle sheep cells, neural tissues, plus melanin deposits are present. Clinical features have feeding problems and increased VMA, vinyl mandelic acid, and urine. Biochemical findings. Okay, then benign tumors of muscle tissue origin, leiomyoma, benign neoplasm of smooth muscle origin surrounded by surrounded tissue of blood vessels, surrounded tissue of excretes of salivary ducts, surrounded by circumvallate papillae or associated with circumvallate papillae, also called as spindle cell neoplasm. Then treatment is simple surgical excision, have good prognosis. Surround tissue of blood vessels. Leiomyoma, surround tissue of blood vessels of excretory, salivary duct and associated with circumvallate papillae. Then rhabdomyoma. Okay, benign neoplasm of skeletal muscle origin. Benign neoplasm of skeletal muscle origin. Okay, rhabdomyoma is a benign neoplasm of skeletal muscle origin. If it's not myoma and it's rhabdomyosarcoma, then it's malignant and skeletal muscle. Then clinical features in head and neck region. Most common site is pharynx, floor of mouth. Okay, base of the tongue. Obviously, floor of mouth and base of the tongue is same thing. Yes, and then soft palate, soft tissue swelling. It is seen in head and neck region, soft tissue swelling. Histopathology, polygonal cells are seen, vacuolated cells, cytoplasm rich glycogen. Cytoplasm rich glycogen is present with the which is granular. Cytoplasm is rich in glycogen and which is granular. Okay, rich in glycogen and is granular. Cytoplasm appears as cut section of myofibril. Shows presence of striations. Treatment, surgical excision, good prognosis. Then granular cell tumor or myoblastoma. Granular cell tumor or myoblastoma, also called as abrikosov tumor, most common site myoblastoma or granular cell tumor. Okay, most common site 80% is tongue. That's why muscle origin it is. We call this at tumor of neural tissue origin. Now we describe it as, now we find out histopathologically find out that it's a neural tissue origin, but it is most commonly present on tongue, so that's why we consider it under muscle tissue origin. Okay, then recent nerve tissue origin, Schwann cells, recent studies, due to Schwann cells it is present. Granular cytoplasm is there, that's why the name granular cell tumor or Myoblastoma, PS positive granules are present here. Then proliferating rete ridges are present exhibiting pseudoepitheliomatous hyperplasia. Proliferating rete ridges are present exhibiting pseudoepitheliomatous hyperplasia. Pseudoepitheliomatous hyperplasia, not pathognomonic because keratocanthoma, necrotizing cryomatoplasia, and reactive lesions like myogenic granuloma, peripheral ossifying fibroma, and peripheral giant cell granuloma also seen here. Pseudoepitheliomatous, so that's why it's not pathognomic of this disease. Okay, or pseudocarcinomatous hyperplasia. Pseudoepitheliomatous hyperplasia or pseudocarcinomatous hyperplasia. Okay, then islands of epithelium and connective tissue usually seen in carcinomas. Islands of epithelium in connective tissue. Differential diagnosis, so called pseudocarcinoma. Pseudocarcinoma, also called as pseudocarcinoma. Differential diagnosis, if we have to differentiate between carcinomas and this myoblastoma, then we can see dysplastic features in carcinoma and not in myoblastoma or granular cell tumor. The Newman tumor or congenital epithelial. Newman tumor or congenital seen in 0 to 6 months in infants or newborns. Newman tumor or congenital epithelial. Type of granular cell tumor or myoblastoma. It's a type of granular cell tumor or myoblastoma seen in infants. Most common site is maxilla. But the difference, okay, it is seen in infants. Okay, granular cell tumor or myoblastoma seen in second to fourth decade. Okay, it is most common site has its maxilla. Newman tumor or congenital epithelial is seen in maxilla, and here it is seen in granular cell tumor or myoblastoma. Myoblastoma, nerve tissue origin, but most commonly present on tongue. That's why I consider as muscle tissue. The tongue, most common site is tongue, and here it is maxilla, and histopathology is absent here. Here pseudoepitheliomatous cells are seen. The rest is same for both. Thank you. That's now we completed with non-epithelial tumors or of oral cavity. Now we will start with epithelial tumors of oral cavity in the next class. Bye.